Okay, so this is the first year, second year mentee mentor meeting we have for Ortho 2 and MSA. I'm with Brendan here, and we just went over his special test videos and just talked through any questions he had on those psychomotor skills. He feels pretty confident about that moving forward. Progressing through the program and just in terms of preparing for that MSA lab practical. With that being done, we'll dive into the special test that he's going to perform, and then we'll follow that up with the overhead squat assessment, and I will demonstrate that. So we'll start with Brandon here with the test.
Okay. So for this test, we're going to be doing the Hoover's test. It's a test for the lumbar spine, lower extremities. Basically, it's for checking for malingering. So what we're going to be doing is going to have our patient lay supine on the table, and then I'm going to hold both heels, asking them to move their leg up. So I'll be holding both heels here, and what I'll be doing is asking the patient, can you raise your left leg for me? And when they do that, I should feel that right leg press into my hand. Now if they do not do that, if they claim that they're trying but you don't notice anything, then you know that they aren't giving you their full effort.
Okay, so for the overhead squat assessment, something you see in the FMS, one of the tests that you have your patient do. Basically, as the examiner, there's certain parameters that I want to see from upper extremity to lower extremity on this, and I don't want to go over those parameters with the patient. I want to be vague about it. I'm just going to ask him to simply perform the squat first. So we will do that. The patient will have a dowel with him, and what I want you to do with this is I want you to set the dowel on top of your head, and I want you to basically make a 90-degree angle with your arms. That's kind of the position you want your arms in, and hopefully you can hear this. But essentially, I told him to just put his arms at a 90-degree angle with the dowel overhead. Now you can raise the dowel up and just go ahead and perform a squat for him. Okay, so, and then I'll have you turn to the side and do that again. So you want to get a front and side view of how your patient does it. Okay, so there's a few things that you want to look at when performing this assessment from the front and the side. When you're looking at the ankles, obviously we need some appropriate dorsiflexion to keep our heels from raising off the floor, and if you see that, that's not perfect form. And obviously the toes pointed forward and not externally rotating, oftentimes you'll see that. At the knees, you don't want to see the knees migrating out. You want to see nice, straight, symmetrical positioning of the knees, and if they migrate out, that usually suggests a weakness or a muscle length imbalance. So moving up, obviously can they get to 90 degrees with their upper legs just parallel to the floor? Oftentimes patients will just have trouble getting down to that depth. And also with his spine, is their trunk lean forward? And that's something I see with my patient a little bit, is he's leaning forward with the trunk. And also just the range of motion. You need optimal range of motion to get your shoulders overhead, and oftentimes if we don't have that, there can be, trunk lean to kind of make up for that lack of range of motion. So that's something that I saw a little bit there. So I wouldn't score him as a 3 because his back wasn't straight, essentially. So usually you want a 2x4 to do the next test to score for 2 or 1, but we don't have that, so I'll just use this, and I'll have him sit on the lip here with his heels. So we'll just have you do that test again from the side, and then we'll move it going forward. So you can go ahead and do the same thing I told you to do with your arms, and you can just try that squat again. So you can definitely see a difference with his back. He's not leaning as much forward, but there's still a little bit of lean, which is fine, but we'll have him rotate this, and now we'll get a kind of a forward view of it, so you can see what he's doing with from the anterior perspective here. Is his knees migrating? Is his feet migrating? So that's much better now. Okay, so that's essentially if they're unable to meet all those parameters with the dowel, or sorry, the 2x4 underneath the heels, and that's going to be more of a 1. One thing you also want to ask is the patient feeling pain doing that movement? And if that's the case, then it's not a 0. If you get pain at all during any of the tests for the FMS, that's an automatic 0. So sometimes when you see the knees migrating out, that's or in, you can see knees kind of collapsing when they do a squat. That's kind of a sign of to me, is I see that a lot with patients, and that's usually a sign of abduction weakness. So the corrective exercise that I want to go over too with that, something I have to do, is I'll have my patient kind of get on the table here and sideline. So you can just go ahead and get on this table, and I'm going to run you through it. Yeah, just go ahead and face me. And essentially what I want you to do here, Brendan, is just perform a side plank for me, but you're not going to go off your knees. You're just going to raise your hips up. Okay. And so you can go ahead and do that. And then once you do that, raise this leg. And then you can go ahead and come back down. So you can do that for reps, or you can do it for time. If the patient's able to hold it for time, you can try and have them hold that position for 30 seconds or a minute if they're, it's just going to depend on what they're capable of doing. Or you can just have them do like a repetition base where you just goes up for a few seconds, comes down, do that maybe 3 sets of 10 kind of deal. But what this does is this challenges the glute medius. So for hip abduction, it takes some hip abduction to get his hips off the table, and also on the other end to be able to raise his leg against gravity and kind of fight that. So if you have a patient who is squatting and their knees kind of collapse in, one thing to look at is that hip abduction weakness, and this is a corrective exercise to address that impairment.